while we treat patients with small cancers, we want to make sure that we burn the nodule very well and burn the surrounding tissue around the nodule very well. What does that mean? We usually focus on providing more energy to the nodule. We stay longer there to get more joules and more power inside the nodule. We were able to publish before and show that the more energy we place in the nodule, the more heat we generate in the nodule, the more response and volume reduction rate that we accomplish. But also we burn the tissue around it. And one important thing here when I treat these patients, I counsel them very well about this. In general, when we treat benign nodules, our routine follow-up is 3 months, 6 months, and then a year afterwards. To look at the volume reduction rate, we calculate the 3-dimension, the width, length, height, and then calculate the volume and do the volume reduction rate. I usually have a nice Excel file and I share this with the patient. I email them or send it to them, etc. That's different from cancer. What's very well documented in the literature and what we saw and experienced, that actually in the first few months after burning cancer, you will see a completely different picture. It actually looks like it did increase in size, it did grow because we burned the tissue around it and looks worse. So you want to make sure you understand what's going to happen. For example, also, in benign nodules, you expect the best outcome to start to happen by 6 months, and some of them can continue to shrink up to a year for benign nodules. For cancerous nodules, your best outcome will happen by a year after the ablation. So this is very important to understand, because if you do an ablation for cancerous nodules and a month after you are going to repeat, I'm telling you right now, it's going to look worse, it's going to look bad, and everybody's going to... So I actually do not do an ultrasound. I mean, we'll have an idea at 3 months, but we don't expect to see anything before 6 months, and we expect to see the best outcome by a year, actually.